However, if you are interested in the slides afterward, just send me an email because it's a lot of information. It's a big file, a slide deck. So just for introduction, my name is Luma. I am the, I can't even talk today. It's a hard day. I am the programming chair and vice president. Um, Part of what we do in diversity in dentistry is just to give out like information, especially the information you not have to look for, like from the goal setting workshops and our workshops on like writing your personal statements and things like that. And I had a very interesting conversation with one of the I am on the interview committee for my school, and we had like this conversation and where some of the interviewees were arguing about dental specialties and what you can do after dental school. And it dawned on me that even when I started, I really did not understand what the options are. I have a lot of professors that will talk about not everybody will do the wet finger dentistry. So um, in as much as you try to think about dental school, it is important to think of the options because the things you do during dental school will help to determine your options afterward. As I mentioned today, it's an interesting day. So I have changed the quote of the day today too many times. But what I ended up settling on was that I am strong enough to face my fears. There is a lot of uncertainty. I see everyone that showed up today, it's still women. There is a lot of uncertainty, especially being a minority, being a woman, and everything that comes with it after yesterday. I just want to share that as much as it can be unsure, uncertain, even for the people that is what they wanted, as much as you can be happy, there is still uncertainty. As much as you might feel some type of way, there is a lot of uncertainty. But understand that you have it in you to go through anything. This is just it's such a short time in the bigger scope of things, and you have it in you to get through anything and more. So, um, as I shared, a lot of us get into dentistry without understanding what the options are. For a special, every dental school teaches you how to be a general dentist. General dentistry will give you the foundations. It will give you the foundation of oral care, but there are certain things that are more than that. For instance, there are some third molars that you do not want to touch. You want to send it to an oral surgeon. And if you think about it, as much as you're getting into dentistry to help people, what happens to those immune compromised people? What happens to the people with special health needs? Is dental school enough to train you to be able to handle that? I know it's like two steps ahead, but if you can plan 10 steps ahead, it makes the steps easier when you do get there. But just put it in mind that dental school is going to teach you how to be a good general dentist. However, there is more than being a good general dentist. And just depending on several factors, you might choose to decide if it is something that you want to go further. Because believe me, as much as that DDS or that DMD is impactful, there is so much more that you can do with more. The things to consider when you're thinking about a specialty is personal interests and areas of strength. I know there's some people, I have classmates that will only work with kids. It might just be because those are temporality, and if you mess up, there is a way to fix it when the permanency come out. Or it could just be they don't want to deal with the hassle of adults and adult opinions. It could be you're interested in cosmetic dentistry and how that smile really looks. So just your personal interest. The one that I'm hoping, as much as we have passion, that we all look into is the market demand. Look into it as much as you can. General dentistry is very much going in the directions of DSO. Many people Many people think about dentistry because of the work-life balance, but understand that the DSOs, it becomes challenging to have a work-life balance it becomes a little challenging to have a work-life balance. So just look at the market demand, look at the work-life balance, and look at the flexibility. Are you interested in being an oral surgeon where you're in the hospital all day, every day? Or do you want to do pediatrics where you're for sure 9 to 5, weekends off? Please consider that as you're thinking of this career, because usually dentistry is like a stop career. You usually have people changing careers into dentistry. It's a very good stop career, but think about your interest, your area of strength, what you can do with that degree, because it is really painful to take 4 years of your life and go 400,000 in debt um, for something that does not have the flexibility and growth that you had in mind. So, a main option, a good option to consider is the 5th year of dental school. It's called the 5th year of dental school, which is the advanced general dentistry. It could be as little as 1 year, but it's typically 2 to 3 years if you really want to get your speed up, get your feet wet. It is 2 to 3 years. It doesn't come cheap. It is usually about 80 to 150,000 more. Do understand that you're missing out on the dental income in that time, but it will increase your speed. It will give you access to a hospital setting because most of dentistry is outpatient. To be able to understand how to use the hospital, especially if you're doing sedation cases. It is not something you learn in dental school, so it's important. It will be helpful to do that ADG to give you like that leg up to understand how the hospital system works, how a dentist works in the hospital, and also the interprofessional lessons that you might learn working with other disciplines is really helpful. I do have a fun fact on there, but I don't know if it's much of a fun fact, but it will teach you how to manage complex cases. So there are 12 specialties. There are 12 options that you can go in depth in. The 12 specialties, I know everyone knows of PEDS, everyone knows of OMFS, which is the most common one, PEDS and OMFS. And a lot of people go into dental school with this tunnel vision of that is what I'm going to do. Just broaden your scope about what is available as well, especially since most people do in your gap year, most people do an MPH. If you do an MPH, there is dental public health, which is really important because almost every place needs it. And if you are like me, who is probably where you are too old, and you're probably worried about like your joints and your back and things like that, this is a good option for where you don't get to wet hand dentistry or no gloves dentistry, where you could focus on policy and research. And do understand that if you did an MPH during your gap year, you already have a leg up. For me, I am doing the MPH during dental school. So technically, I'm specializing while in dental school. It is a possibility. It gives you that option to work with health services departments and work with agencies and things like that. You are doing more like population impact. It has its pros and its cons. A lot of programs are now doing the dual degree. If it is something you're interested in, look into schools while you're applying, look into schools that offer that. Because by me doing a dual degree, I'm getting like half of my credits as part of my dental program already. And for something like the contact hours for research for MPH, my time in clinic is counting at that. So consider it. Um, I put in like an average salary for that. It really just varies on like the location where you are. The other option is dental anesthesiology. This is very fairly new. But you get to do sedation for different offices. The training is about 2 to 3 years. You do the sedation, the pain management, but then a typical anesthesiologist will go from office to office doing like sedations for procedures that need like long-term sedations. Um, the salary is really on the conservative side, but there is a lot of potential there, especially if you end up doing like a 1099. And It could be at private practices and it could be at hospitals as well. And then there is the one that everyone loves to hate, endodontics. I say that especially for Dr. Worrell because he's the endodontist and he's having so much fun and nobody likes endo. If you are really good with attention to detail, it is something to it's something to consider because you need a lot of attention to the detail, finding those canals. And a lot of the challenging things of endo are being addressed by the new technology. It is still 2 to 3 years of additional training. You do have to pay school fees for that, but there is a lot of job satisfaction because your treatment plans are always complete. By the time someone is showing up needing an endo, they really don't have a choice. They do have to pay for it. So there is that growing demand, there is that job security, but then it is 2 to 3 years. You're missing out on the income you could be making working, and you have a salary that is a little bit more, but just think about it if you want that guarantee that any patient that comes to you will actually complete their treatment. And then a lot of people talk about oral and maxillofacial, but there is more. There is like pathology and radiology. The pathology is 3 years. This is one is very common for foreign trained providers because you could just do it as a master's program. You do still have to pay the masters, and it is like really niche in terms of like research and teaching opportunities. That is why I know we do have some people that are foreign trained dentists. This is a really good opportunity option because then you can work in academia and hospital settings before you get your license. And it's something that you need all the time because even a general dentist will send you their pathology for you to help determine what it is. And then there is the radiology. Um, at my school, our radiologist has been a dentist since the 60s, and he has never done chairside dentistry. These are the people that take your CBCTs and things like that. So radiology, you really do it's almost like a medical radiologist. I joke that they are somewhere in a dark room, but they interpret the things that we see on a radiograph and assist in like the diagnosis and planning. And the best part about it is that you never have to say this is cancer or this is this. You're like this shows signs of being cancer. So it takes away a lot of the liability from you. However, it gives you that chance, just like a medical radiologist, to be in some corner and just doing interpretation. Again, this is dry glove dentistry. You don't have to get your hands wet, and you still have the comfort and the benefits of being a dentist. And then the one that everyone goes into dental school wanting to do, or that a lot of people go into dental school wanting to do, oral and maxillofacial surgery. There is a lot of controversy about if you should do the 6 years or the 4 years. Back in the day, it did not matter at all which one because you still get the same privileges. Lately, there is some concern about giving hospital privileges to non-MDs. So if it's something you're considered after dental school, a probable good option for you is doing 6 more years, two to get your MD degree and the other 4 to get your oral surgery. It is very okay to do the 4 years. However, just consider that with the way things are changing, it might be required to get an MD to get hospital privileges. However, this is the highest paying dental specialty. You have a lot of flexibility. There's a lot of career options. And for the most part, you're not just working with dental teams, you're working with dental and medical teams, or you're working with a lot of diverse teams. I do know an oral surgeon that only does sleep medicine. He only works on the trachea and the larynx, only does sleep medicine. He still has relationship with like 3 hospitals to get in the hospital-based money and things like that. It is very lucrative. However, 4 to 6 years after dental school, which by the time you're in the end of your first year, you're probably so over it that the thought of an extra month might kill you. But it is 4 to 6 years after high earning potential, a lot of diversity of what you can do. And then there is the oral medicine itself. It usually goes in hand with oral pathology and oral radiology. You're doing a lot of like the diagnosis of like oral diseases, not just for the teeth. You're doing more of like mouth cancer and the whole vocal cavity. Um, a common one is for like patients that get like Noma, the flesh-eating bacteria, where you have to take out like most of your mouth. That is usually managed by an oral medicine person. Like the surgeon will do the enucleation, but the oral medicine will be the person that will like be helpful in what else needs to be done. It is usually multidisciplinary as well. And if you don't want to do the cutting of oral surgery, it is a good option to think about. Again, it is not purely a dry hand dentistry, but it can give you the opportunity to do dry hand dentistry. And it's still the 2 to 3 years of training after. I really could not find a salary estimate, but it's definitely more than general dentistry, but it varies a lot. So I did not put that on there because it varies a lot. I was seeing from 400 to a million and it varies. And then there is orofacial pain. We have one of our mentors, Dr. Susie Bergman. She gave a TED talk about like TMJ issues. I think lately a lot of people are realizing that there is like so much more to this tiny joint. It's the only bilateral joint in your body. And if it messes up, it gives you a lot of issues. So when people think of orofacial pain, that's like the first one because that is the one that most people talk about. However, it has other things like sleep-related disorder or even migraines. And as an orofacial pain specialist, you work a lot with like physical therapies and neurologies and pain management, especially people with like things like fibromyalgia. If But what I have seen so far, especially if I'm talking to people like Dr. Susie Bergman, it is mostly a passion thing, but you handle all conditions from like the head, neck, and facial regions. It is um it is a master's program as well, 2 to 3 years of training, and with the same cost estimate. Um, it really, really it's a multidisciplinary approach to chronic pain management, and especially with the population getting a lot older. Remember when I said you should look at like the career outlook and the job security? It has increased job security because of the older population. And then there is the ortho. Um, Ortho is really interesting because I do know right now braces are back in. I remember back in my day, it was like the worst thing to be a brace face. However, people are understanding that it is not just for straight teeth. There is so much more that you need to adjust with ortho. It is a master's program as well. You do need to take the GRE. So if you had to take the GRE for your master's and you're considering this, do consider to make your connections early because I think the GRE is good for is it 4 or 5 years, and you probably not have to take it again, which is a pain point for a lot of my classmates because learning those vocabulary words, believe me, is not fun after you've been so immersed in dental school. Um, However, talking about job security, there is a very, very high demand in urban and suburban areas. Braces are not just for kids anymore. There's a lot of adults that are finally deciding to fix the issues they had with their occlusion at an older age, and it is consistently high paying. On the day-to-day level, you probably will be dry glove, but there is a lot that goes into like the bending of the wires and knowing where to place it and where to change it. Um, there is the job security because that is why, what is the name of the clear aligner one? There was like the remote clear aligner thing that was such a big deal, and then it had to stop because you do still need an orthodontist to be able to evaluate the teeth movements. And then there is the other favorite one, a common one, pediatric dentistry. Our founder, Dr. Lila, she's been a pediatric dentist for over 20 years. Um, it has become very competitive. But from when I started to now that I'm at the point where, from when I started getting interested in dentistry to now, it has become so much more competitive because a lot of people are wanting to go into pediatric dentistry. Understand that pediatric dentistry, working with children and adolescents, it is very different from adult dentistry. Um, just because for the most part, your treatment plans will be complete. Most kids do have CHIP or Medicaid that is covering for your payments. So you really have less hassle with insurance and insurance things. However, you still have to deal with the parents. Most pediatric dentists joke that their biggest pain point is not the patients, but the parents. However, in you have that growth opportunity in both private practice and hospitals. Most programs will give you a sedation certification. You learn to handle like the unique children behaviors. If you love kids, if you love working with kids, it's perfect. The cost of training is the same 2 to 3 years. But the salary says that the average is about 150 to 220, which is such a broad range. But the pediatric dentists are, make way more than that if it's a money thing for you. But if you're looking for that reward of working with children, it is a really good thing to consider. A lot of people are going into it. There is a higher chance of having your own practice, and you get to learn like the unique behaviors with children and things like that. You get to wear the fun scrubs, the fun socks, and things like that. And then there is the perio. Um, Perio is an additional 2 to 3 years as well. I'm sure if you all can see the theme, it's almost 2 to 3 years for almost everything. Um, the big thing about perio lately is that before, like not so long ago, most implants were being placed by oral surgeons, but now periodontists are becoming more comfortable or more renowned for placing the implants themselves and doing the regenerative therapies. Again, with the older population, you have a lot more people having gum diseases, where it brings in that job security. And they usually work very closely with like restorations, like prosthodontists. But if it is something, if you are not iffy about blood, this is the place for you. Like doing those flap reconstructions and trying to give people their teeth back, because a lot of people lose their teeth to poor oral health and they find out like when it's already too late. And then there is a prosthodontist, the dentures. Um, this one, if you are a lot of us, when we apply to dental school, we talk about being very good with working with our hands. If that is truly your passion, this is the place for you, because you're recreating smiles. We have one of our mentors, Dr. Eva Baldridge. Her social handle is Houston Prosthodontist. It is amazing how she can transform the most, for lack of a better word, the most jacked up mouth to something really presentable and decent. But they do understand that it's not just the dentures, because with the aging population, we have more need of restorative care. It is that crown, it is that one missing back tooth or front tooth, but they're restoring function. It's usually like the last phase after you've done all disease control, but they do understand that because of that, you're working with general dentists all the time, um, with people losing their back teeth and being able to needing to chew and things like that, you continue to have that workflow coming in. And as I mentioned, if you really do like working with your hands, this is a place for you, because you're designing all the aesthetic aspects of someone's mouth. So, the part that I hope that you get, is that dental school will teach you how to be a great general dentist. However, as much as that is such a far-reaching goal, I'm hoping that as you're going through it, or as you're thinking about if you're going through dental school, if you're thinking about applying for it, don't just think one step ahead. Think two, three, 4 steps ahead. Think about what you will do after. Again, focus on what your passion is. Focus on what the work-life balance might be. Understand that DSOs are here to stay. It really, really changes the how dentistry will be practiced, because it is now more for profit. The likelihood of opening your own practice is becoming slimmer by the day. But many of that will change if you do a specialty. specialty changes that it makes you almost like an expert in an area. And for the most part, as a specialist, if anyone is coming to you, they really do need that help, your treatment plans will be complete. So that is what I had. Did anyone have any questions, concerns, anything to add? Or did anyone have anything to add? Anything that you like for me to touch more on? I know we are all having a tough day, so I understand. Anything? Okay, then. On to other things. So as I was sharing to the people that came earlier, we are working on getting, yes, that yes, the recording will be shared. It has been recorded, it will be shared. However, the PowerPoint is a little heavy. I'll have to share it. So if you do want the PowerPoint, do let me know and I could email it to you. It is just important to know. And as I shared when I started, um, we've always had, and let me not forget to add that we have usually always had a dental specialty panel. I think it is different talking about the possibilities and actually talking to people that do it. If you go down to our recordings in YouTube, we had that specialty panel that almost had everyone from every dental specialty talking about what their inspiration is, what they like and what they don't like. We are hoping to do that again in February. Um, but this whole conversation came up because while I was interviewing some incoming students, there were a lot of them that did not know that they have up to 12 dental specialties and what the options are. So if you're interested in this, let me know. Or if on your own, just look into it because as my mentors say, wet hand dentistry, that is actually in the mouth dentistry, is not really for everybody. So just look at all the options that you might have, especially if something happens like carpal tunnel or something, or as my mentor will tell me, the first thing you do as you get into dentistry is to think about how you get out. So just think about that. If you want it, just let me know. It's a little bit of a big file and I could share it to you. Also, I know pros is for the true artist. I could not do pros. I cannot draw a good circle, so I refuse to try to recreate anybody's teeth. I love arts and craft. I love creating stuff. But the details that you need to create teeth, I could not do pros. I don't know how Dr. Eva does it, but she's great at it. I could not do pros. It is different, especially when you start doing like the mounting of the teeth and making sure that it's like a line center and things like that. Okay, so if you want it, just let me know. I'll send it to you. Let me see. Let me see if I can drop it in here. So, what I was sharing earlier is that one of the things we are starting to do, we're starting to have office hours. We are at the point where we do have mentors that are amazing and are doing the one-on-one mentorship, but we do not have enough of them. So we are going to have office hours. It will very likely be on a Saturday or Sunday. It will be just like our mixers, but you have to sign up for it with what it is that you need, and we'll get a mentor that can help you with it. We will hopefully have the first one this weekend. So do let us know what you need, and we'll get one of those mentors that are willing to mentor, but are just not able to have that commitment because I think we were so successful before because a lot of our mentors have had that relationship for 3, 4 years. And a lot of the new people just feel like they would not have that time commitment. However, if it's a one-off thing, if you need prep for your interview, if you need someone to just review your personal statement with you, if you just need someone to cheer you on, if you would just sign up for it, we'll be able to arrange something for you. I'm still trying to share the document, but from the questions, do many students in dental school already know what they want to specialize in before getting to dental school. It is very common. It is very common to it is very common to go in saying, I'm going to be an oral surgeon, I'm going to be a prosthodontist, I'm going to be a this. Many people come in with an idea of what they want to do. However, same lab will humble you. I knew I was amazing with my hands. I made a lot of things. Same lab for the pros unit, I was like, this is not for me. A lot of people come in with an idea of what they want to do. However, when you actually do it, it is very different. But the concerning part is we just started third year. If you are interested in a specialty, by your third year, there is so much that you need to have done. It is almost like applying for dental school again. Like, I am interested in oral surgery. By this year, I need to finish my CBSE. I need to make sure I have all my leadership requirements. I need to do 3 externships that are 1 week long. So, in as much as your ideas may change, it is important to know what is needed for that. It is important to know what is needed for that specialty that you need because it's almost like applying for dental school again. You need to get your stuff ready to be able to apply. It's everything. You still need to turn in your personal statements. You still need to find letters of references and things like that. So as much as you kind of have an idea of what you think you like, when you actually do it, it's different. Because especially oral surgery and pediatrics, I have a lot of my classmates that they got in and was like oral surgery. People started studying for the CBSE from first semester. Whew, after they took out that first third molar, they don't even want to think about it. It is very different when you actually do it. Or the ones that come in like they're all for peds. And you have that kid that sits in your chair for 3 hours and does not open their mouth and keeps biting your hand, and you're like, I'll do better next time, and it happens again next time. It's like, I cannot do this. So it just depends. For a good candidate to perio, um, because interestingly, a lot of the residencies still need you to shadow, which is funny because there's no time in dental school, but you still need to shadow. So if you're interested in perio, if your school has a graduate program, shadow them. If you, a lot of the schools usually have this community dentist outreach thing. If you meet a perio, do shadow. Like you need to shadow in perio. Like it's almost a given. It's going to come up in your interviews all the time. Shadow as much as you can, build those relationships because it's just the same as applying for dental school. They'll ask you for a letter of recommendation from a periodontist. But and you're like, I'm in school Monday to Sunday, 25 hours a day. Where am I supposed to get that letter from a periodontist? But you do need to shadow, you do need to have that relationship with a periodontist that can write a letter for you. You do need to be able to get a letter of recommendation from the head of your perio department from your school. I am not certain if perio does need I'm not certain perio does need the GRE, but there are some externships that you need to do as well. But all of this, it will be really challenging trying to do it in your third and fourth year. It is something you need to have started earlier. It's not that you have to, it will be, it's not that it cannot be done. You can do it, but it will be challenging to do that in your first few years. So what I would do is that regardless of what I want to do, I will still shadow very broadly, especially when you get it, build a relationship with those department heads, even if you don't want to do that specialty, even if you've not thought about it, make it in such a way, like when you do that unit, make it in such a way that if anybody asks that head about you, they could be like, ooh, he or she was serious. Ooh, he or she can do this. And that brings us back to SimLab. I see Isaiah. That brings us back to SimLab. SimLab is a humbling experience, but take your criticism with grace. Like take it as an opportunity to become better, build those relationships, shadow, do externships if possible. A lot of us do not take our spring breaks because we are shadowing. Shadow, do as much externships as possible, build those relationships because you still need those letters of recommendation. And I was like, I am done, I am in, I don't need any of this, but you still do. It's like SimLab is no joke. SimLab will humble you for dental missionary work. From the accent, I'm African, I'm from Cameroon. Um, I used to do a lot of missionary work back in Cameroon. However, understand that while you're in dental school, you do not really get breaks. So you do not get breaks. You do not have any money to travel, so you're probably raising funds for travel. But there is a lot of opportunities to travel. I do know, like my school is going to Puerto Rico this December, but you're paying for your own travel and accommodation. I cannot afford that. As much as that is important, um, there is still homeless shelters in every town that you are in. I am in El Paso. We have like that big migrant population with all these Haitians, which helps because I speak French. There is, as much as the missionary work is amazing, it is good, it looks great on your resume, please do not prioritize it. Do not prioritize it because for the most part, you cannot translate it to the standards here in the US, and that matters because you could I am in El Paso. We go to Juarez for Christian Helping Hands. In as much as I can pull out 10 molars when I'm there, we are doing it on the lawn chair with local anesthesia. As much as that may seem amazing, it does not really translate to what I can do when I am on this side. Does that make sense, Priscilla? But do understand that those opportunities will be there. It is really best to do it while you're a student and you don't have responsibility and no student loans are due. But it is, you have to pay for that by yourself. It will be a challenge translating that experience to something here. All of that falls under the blanket of like community service or community minded. There are other ways to get it without that stress. But the main thing I would like for you all to think about is that if it is even a thought in your head that you would like to specialize, as you get into dental school, because I know all of you are going to get it, as you get in, start thinking about it and planning for it. It could be the most minute thing. Join student government as your leadership experience. Most schools have these community outreach things. Join it. Humble yourself in SimLab, get the feedback, build those relationships that you need with your department chairs because they will break or make you. We have a lot of D4s that are deciding in this 4th year that they want to do specialty, certain specialties, but those department chairs have already chosen their favorites. It is hard to break that favorite thing if you're deciding late. It is better to be general all around, but then do those extra steps in case you want to break off and do one thing. You already have built that reputation. And the application for most of these specialties, it is that almost that same application for dental school. It is long. So do take your time. If it is something you even consider or think about, look into it now. Because we joke about planning 1 or 2 steps ahead. In this field, especially as minorities, we need to plan at least 10 steps ahead. Like have option A. If option A fails, have option B, C, and D. Because as I have shared, I'm interested in oral surgery, but I'm still doing public health. I am still in the pediatric group. I am still in the periodontal group. I am still in this, like, because especially with the way we all see how things are going, the first plan does not always work. You plan for the first plan to work, but make sure you have, if plan A doesn't work, there are 25 more letters in the alphabet and make sure you have that backup to save yourself some peace of mind. But if anyone has any question, please go ahead and continue to type. And I'm going to see if my old tired brain, after crying so much yesterday, can figure out how to share these minutes. This what oh, shoot, it's in here, it's in yours. Yeah, let me close out of it. Did that work? Y'all get them? Does that look like it worked?
No.
Did this work this time? I think I sent it to Tisha only.
Yeah.
Okay. And if you are looking to sign up for the webinar for the office hours for this weekend, just send me an email. Please specify what it is that you need help with, because remember, we're getting people that cannot commit. We're getting people that cannot commit to mentorship to help. Worst case scenario, since it is short notice, because if you are part of the IDID and you have that thing this next week, we would like to help prepare you for that. So worst case scenario, I will help you as much as I can. If not possible, I will refer you to someone that can help, but we'll do our best to help you because believe you me, we need you. Dentistry needs you more than you need to be a dentist. So if there's anything we can do to help, we will help. One thing that no one prepared me for dental school, um, dental school is high school 2.0. I was not prepared to see this many clicks. There is a lot of clicks. I don't know if Isaiah will agree with that, but I think the most shocking part for me was the clicks. I go to a Texas school. We are not graded. We are ranked, but we are not graded. However, the little clicks were a little concerning. It was I was able to cope with that because I have other responsibilities and I have 4 kids that are very busy in almost every sport. However, it's like when you're trying to like ask for something and it has to be okay with the group first before they let you in on something or share resources and things like that. That was the most shocking part for me. The other shocking part was I see because I am coming back to school after graduating in 2005. I was of the belief that I will actually have my hands held and walk through the process. Understand that the DAT is like 1 week of dental school. For me, anyway, it is a lot of information. You are expected to be able to absorb a lot of information in a very short time. I was not prepared for that. I had to struggle with preparing myself to be able to do that. So I think which goes with my quote of the day. It was like regardless of our fears, we're strong enough to handle all our fears and all our challenges. Um the curveballs in dental school will just keep coming and keep coming and keep coming. You need to be really adaptable. You need to be able to learn how to fall foot first. Like fall forward, land on your feet. Because you start off in SimLab. SimLab will humble you in ways you will not even believe. It will be like you've done your best, you've done that prep for 2, 3 hours, and someone will just look at it and be like, wrong. Or just something like really condescending or something of that sort. So you need to grow a thick skin and grow it really, really fast. Those were my top three. Dental anesthesiology. It is really new. It is, and it's very interesting because for the most part, you're doing dental anesthesiology is fairly new. You're doing your training in the hospital with medical anesthesiologists. So, like literally during the call out of a surgery, you call out your name, DMD or DDS. It is really lucrative. It is very flexible. However, doing it, I will just keep it in the back of my mind that the AMA is a very powerful tool. The American Medical Association, it is a very powerful tool, and they do not like it. They do not like dental anesthesiology. So as much as you want to lean into it, as much as it gives you the chance to work in the hospital as an anesthesiologist or just walk around and do sedation, as much as it is a few years, it's just the important years of oral surgery program. You just do your anesthesia, you go and you do your anesthesia. You still have to take the CBSE for dental anesthesiology, which is the equivalent, is almost equivalent to the step one that you need for oral surgery. Just keep it in the back of your mind that the training is very AMA based, and AMA does not like it. And AMA So having to depend on another organization that has that much power, it's just something to be on the lookout and see if at some point they will revoke it or not. However, it is a very lucrative dry hand dentistry option. We got this teacher being non-traditional adds its own challenges, but then the joke that I do with my other non-traditional colleagues is that it gives you an extra kick in the behind. You manage your time so much better than your peers that do not have the responsibilities. So being non-traditional, I think you are more mature to handle a lot of the things that come with school. You have to be okay with not interacting with your classmates at the level at which they interact. A lot of my classmates, a lot of my classmates end the week by hanging out in a bar or hanging out downtown or having a house party. I cannot do that. A lot of my classmates will stay after school to study. I need to pick up my kids from school. I really cannot do that. So as much as you prepare yourself for that, just prepare yourself of the differentness of your dental school experience. The best email address for me, ooh, I don't even remember my email address off my head. Is the VP email? What's the VP email? Let me find it.
Okay, thank you.
Because that is the best one for me. My personal email, I will not even give it to my enemy because I don't go there no more. I have not seen it in a while. But at least for this one for diversity in dentistry, I check it often. So please, if you're requesting the office hours, please be specific what you would like. That way I can easily find someone to help. But do understand that it's just because um it is really difficult to make that commitment of time. We have amazing people that have made that commitment. I cannot wait for Isaiah to be done with dental school and I'll just volunteer him as a dentist, as a mentor. But do understand that if you send me the details, I'll find someone to help you. Worst case scenario, I will be on there myself and I'll do everything in my power to make sure you get the help that you need. Anything else? Everyone straight? Everyone? Okay. I will go ahead
Yes,
and
thank
stop the
you.
recording.